My name is Carlotta McCluskey, and I am thrilled that this is our first opportunity to come before the community just to talk about things that we all see or hear about, maybe, or discuss with our doctors. And today, we are also having the opportunity to present to you our program called Healthy Conversations. Healthy Conversations is a beautiful program that has been spearheaded between the health department, and we do have in the house Dr. Green, our health director. You guys, she's back there. And of course, we have with us Commissioner Glenn Adams. Um, because of their efforts and their vision, we now have Healthy Conversations. And Healthy Conversations is meant to have conversations in the community. And it is a partnership with our local barbers and stylists. So to the right of you are some of our barbers. And throughout the program, let's give them a clap. Throughout this program, we have topics that are very important to our community because what we're finding is the statistics behind it that are really detrimental to our community and taking the lives. One of them, of course, is prostate cancer. Prostate cancer is one of them. The second topic is colorectal cancer awareness. The third is heart health. And so we are, of course, needing that advocacy in the community. So this program helps in doing that. How many of us have been to our barber or our stylist, and as soon as we sit in that seat and we let our hair down, or some of us let our hair down, and we have that moment where we can be transparent and we can be vulnerable with them, right? Have you ever had that moment? So when we looked at this program, it was perfect because they literally have day-to-day interaction with our community members, and these are such intimate conversations and topics, but they are perfect candidates for that. So today we're going to talk about prostate cancer. September is Prostate Cancer Awareness Month, which is why we chose this month to go over it. But I wanted to, of course, do some introductions, and I would love for our health director and Commissioner Adams, if they have any remarks, to go first, and then we'll go around the room. I mean, it'd be nice if you come in. And the mic is used because we are, like I said, streaming live so that they can hear us as well. Let's give them a hand, y'all.
Welcome, you all. Thanks for being here this afternoon. Hopefully, this is the first of many, many conversations, and many thanks to all of our barbers and stylists that have. I get to see the back end of it, so I get to see all the data and all the great things that you all are doing. They've had more than, I think, 1,000 conversations. And we do some survey and some data collection, and we get to hear little pieces and little bits of stories in the surveys about what impact it's had. And so I just really want to say thank you all for being here today, and thank you for doing the legwork every day, every month. And it's really cool to see that bearing out in our community. So, and thank you again to the commissioners for their thoughtfulness in funding this. And we're excited to learn something new today. And we hope you don't just make it you're sitting here and listening, but we want you to take it back out and teach and learn with others. So I'll turn it over to Commissioner Adams.
Good afternoon. One of the things is I brought this program to Dr. Green in the health department. And one of the things, as a commissioner, we kind of come up with ideas and then we give it to the people to be able to carry it out. But this was important to me because if you look at Cumberland County, if you look at the state of North Carolina, in general, our health outcomes are bad. And then in Cumberland counties, then ours is worse than those in North Carolina. So you see how that impacts us. And we know that if it impacts the general population, it definitely impacts Black and brown folk even more. And so what we know today is Prostate Cancer Awareness Month. But when I came up with this program, it's one thing that I realized is that, and I stole it from another county because I'm not that smart. So I'm going to give them credit for it up in Halifax County. But here's what the program is that if you grew up in the community and you went to your barber or your stylist, you technically capped them for your entire till you become bald or whatever. Like we getting there. But you went to your barber and your stylist, and you had conversations over and over, year after year, month after month. And so, what better place to be able to have that conversation than with your stylist and your barber? You know, one of the things that I always tell the health department, DSS, and everybody else is we have to go and meet the people where they are. If they don't come to us, then we need to go to them, and that's why we did this program, because we're taking it to those individuals out in the community. And I thank you, stylists and barbers, for being able to do this. We didn't really have to sell this program to them. They were actually already kind of doing this kind of conversations with their clients, and so now that just made it even better. And so one of the things we do know is colon cancer is one of the most preventable cancers there is, if it's caught early. So if we don't catch it early, it becomes a death knell, and the same with prostate cancer. And for the women in the room, I tell you, we'll probably have do something with mammograms and all that. But the one thing we do know is women go to the doctor. Men tend not to. We tend to sit there and say, "Oh, it'll get over. I'll get over that, and I'll get to this." And so this conversation is important to be able to get there. If we save one or two lives, I think we've done what we set out to do. But this has gotten even bigger and better than that, and they'll tell you all of that. So I want to thank Carlotta, the staff. It's them that's out here on the front line that's doing that. The health department, Dr. Green, all of them are doing the work. And so I can never stop thanking them so much. And thank you, barbers and stylists, for being able to be in this program. We're going to recruit some more. We're going to start another cohort of this. And I think this is going to be big for the entire community. And thank you all for coming. I need to thank you all for being here and taking this back out into the community. Thank you.
Sir, let's give him a hand, y'all. Thank you, Commissioner Adams. Such a sweetheart. Okay, so I would like to have Dr. Haigler to come up. And as she's coming up, she is our speaker for today. She'll be going over the general information for prostate cancer awareness. You may have some questions. I'm sure you guys do. You may have some things that you didn't get to talk to your doctor about, or some stigmas that you may have heard in the community, or things that you have, you might have tried to get a brother or uncle or someone to go to the doctor and they gave you some excuse. I want you to write those down. Each of you have with you a note card and a pen. If you don't have one, raise your hand and I'll make sure you get one. But I would love for you to, as we're going through today, I want you to think of some questions. I want you to think about just going to the doctor in general, getting screenings, what things may keep you from going. Some fears, some concerns, because we have a lot of people in this room who are capable in answering those questions. We do have some panelists. Dr. Lori Haigler is one of them again, and I'm gonna be quiet. Mr. Victor Taylor, raise your hand for me. He will be a panelist as well, and he's with the Prostate Cancer Coalition of North Carolina. But he has other hats, but that's the one I asked him to represent today, and I'm sure he'll go over that. We have Miss Sanquis Graham. She is going to be talking to you guys about one of the risk factors with it. And I'm not going to give her spiel what she's going to talk about, but tobacco and tobacco usage is something that we're seeing in our surveys that we're getting back from the community with the barbers. So I wanted to make sure that's being addressed. And of course, we do have some of our barbers that are going to be brave enough to get up here and just go over some of the things that they've seen in their community, even before the program, but definitely while they're in the program, the conversation, how that's going, some of the, whatever their perspective is. I wanted to give them that opportunity just to share, and any questions you may have for them, please ask them, okay? All right, so without further ado, Dr. Lori Haigler. Yes, ma'am.
Thank you all for being here. It is my honor to be a part of this program and to be a part of the Cumberland County Health Department. I moved to Fayetteville back in the early 2000s and have been a doctor in the community, working mostly in primary care all the way up until right or just before COVID, when I came to the health department as its medical director. Dr. Green followed me about a few months later, and it was the pandemic. So it was trial by fire for us, but thank God we made it. Carlotta, thank you for asking me to do this talk. I don't often do these. I'm usually in the office, so bear with me, you all. I wanted to do a bit of an introduction to prostate cancer, and probably most of you know a little something about it because it is such a prevalent cancer. But we'll go over this, and maybe this can spur some questions that us as a panel can work together to answer for you. First of all, let me honor those who are prostate cancer survivors. This month is all about you and helping those who may be able to prevent prostate cancer by getting screening. Let's see if I can get this thing to work. Okay, Carlotta, I've hit all the buttons.
You guys have technology.
I can use the clicker. Yeah, I can do that.
Are you sure?
I am positive.
Sorry.
Yeah, that much I can do for sure.
Set up for us. Okay, guys, we got it right.
Okay, just a little bit of anatomy. So the prostate gland is one part of the male reproductive anatomy. Its main function is in reproduction, in that it is where the seminal fluid that carries the sperm is made. So that's its main thing. But you can see from the location that it's right there under the bladder, and it's where the urethra, or the tubes through which the urine flows, goes right through that prostate. They come from the kidney, go to the bladder, and then through the prostate. So whenever there's a problem with the prostate, there's usually some change in the urinary function. So that's a little bit of anatomy for you there, but it's all there together. And so that can, symptoms in those areas can be indicative of prostate cancer, but also other problems with the prostate. And it's just the real reason to go to your doctor and get checked out if you have any urinary symptoms. And we'll talk a little bit more about that. So yes, what does the prostate do? So important for fertility, helps produce semen, and also has a role in hormone making, and that's the testosterone. So it's really important for the, your male characteristics, developing a beard, muscles, those kinds of things. That prostate has a role in that as well. So here you see what a normal prostate looks like, right? That's the bladder on top, and then the urethra, the urinary tubes going through that little glandular organ called the prostate. That's what a normal one looks like here. And then next to that, you see what an enlarged prostate looks like. Now, no one ever really sees this, except if you're a doctor and you're doing an MRI, or you're looking at an ultrasound or something like that. But the way we examine it as doctors is through a prostate exam. Okay. So when I mention prostate exam, does anybody get like nervous or because when men come into my office, they're nervous about that. They're like, "Doc, are you going to do a prostate exam?" So not every time that you go to the doctor will you get a prostate exam. That has really changed. I can remember when every year or every 2 years you come in for your physical, and the prostate exam would be a part of that. So, but there's been a lot of studies and evidence shows that there's a better way to diagnose prostate cancer. And that's through a blood test called the PSA, which we'll talk about. Okay. So prostate cancer occurs when normal cells in the prostate gland just change into abnormal ones, as all cancers start out that way. There's something on the molecular level that goes wrong, and you get this growth of abnormal cells, which can spread and grow out of control. It's relatively common, about 1,600,000 cases worldwide. 11% of males in this country will be diagnosed in their lifetime. And like Commissioner Adams said, it is a cancer that can be treated or eradicated if it's caught early enough. So the overall 5-year survival rate is over 98%, but an early detection and treatment is definitely saving lives. Okay, some symptoms of prostate cancer. Before we go over those, these symptoms can be from other things as well. Anything that sort of squeezes or puts pressure on or irritates the prostate can cause these kinds of symptoms. And I will say again, just got to see your doctor when any of those things happen. So some of them are blood in the urine, having to really try or force the urine out. You're unable to urinate. You're getting up frequent times at night to urinate. You get, and this, the ones on the bottom are some of the later signs, meaning that you really, if you have all of these and you're getting to things like you've got lower back pain, a burning sensation in your thighs, those kinds of things, or fever, chills, or fatigue, make sure that you go and get checked out. The prostate can get infected and we can treat that with antibiotics. So it's not always, the cancer word, but it's a risk, and if caught early, can be treated. So prostate cancer is not the screening is not always done. You probably noticed when you've gone to the doctor, it may not have even been mentioned, because there are all these organizations, the ones that put out the recommendations for providers. One of them, the U.S. Preventive Services Task Force. I don't know if you can see that small writing, but they don't have very much at all. They put the screening age should be 55 to 69. So that leaves out a lot of people. And we're seeing that prostate cancer seems to be occurring earlier in African American males. So that's, and that U.S. Preventive Services Task Force is used by most providers for screening. The American Cancer Society is better. They say you should begin at age 50, but they have a section where if you're over 40, you can begin at age 40 if you're a high risk, if you have a higher risk for prostate cancer. So what is higher risk? Age, race, African Americans having I would say when African Americans get prostate cancer, oftentimes it's like a more lethal prostate cancer than our counterparts. So it's really important to get screened. The American Urological Association, theirs is good as well. They do say between 40 and 69, you should get screened if you're at high risk. Same from the American College of Physicians. So if you're not talking about prostate cancer when you go to the doctor and getting screened, you should bring it up. And this thing called shared decision-making means that you sit down with your provider and you talk about whether or not you should be screened. Some of the things you would want to talk about is what are my risks? What is the test? What if the test comes back positive? What's the treatment if the test comes back positive? Take that time, or make us take that time to answer your questions. So speaking of the test that we use, you've all heard of, is called the PSA. When the prostate is making that seminal fluid, it has different kinds of proteins in it. And this particular protein, PSA, is one of them. And so the level of it goes up with a variety of conditions, but definitely with prostate cancer. Experts recommend that if you and your doctor decide that you're going to get a PSA, then you should repeat it every 2 years. So one of the things that makes some of those organizations that make the guidelines a little leery about getting screened from prostate cancer is that false positives may occur. And so when you get screened, we want to do something good, right? We want to catch it early, take care of it, so that it doesn't, you don't get the disease. But oftentimes these tests will come back positive, even when it's not a prostate cancer. So there are harms associated with false positive, meaning you're going to subject the patient to more tests, sort of more invasive tests, when it could be nothing at all. And in most cases, it's probably nothing at all. So it just depends on the person. Say there's someone who has multiple health conditions, and some of which are serious. They and their physician may say, well, I don't want to do all of that. I don't want to get a biopsy. I want to just wait and watch. Let's wait and take another PSA test next year. Not a good idea if you're in a high-risk group, though, in my opinion. So you should consider your whole lifestyle, your family, all of those things that are important to you when you make that decision. Other things that can cause an elevated PSA. An enlarged prostate could do that. Inflammation of the prostate, which is called prostatitis. Recent sexual activity with ejaculation. So we always say 48 hours before you go to have this, no more than 48 hours before you go to have this test. Or it could come back, elevated. So if you have what's called the digital rectal exam, that itself can cause the test to be elevated. So if you're going to have it, have the blood drawn before the doctor does the exam, because it could become elevated if you get it afterwards. And speaking of digital rectal exams, those are not recommended anymore for screening. And screening means I don't have any of those symptoms we talked about. I come into the doctor and just as part of my annual checkup, I'm getting a test. You should not be getting a digital rectal exam according to the medical evidence. You should be getting a PSA. Now, if you come in and you say, I'm having some of those symptoms, I'm having the frequent urination, hard to get the urine out, the urinary screen is off, you may get a digital rectal exam, and that's looking for a lump or bump or sort of rough texture of the prostate. It's looking for a cancer. Even bike riding, like a long bike ride before the test, can cause more of that antigen to be in the blood. Okay. So say that prostate antigen comes back elevated. Elevated can mean different things. So most providers would do another test. They would say, come back in a month and we'll repeat the test. If it's still elevated, we're sending you to urology to get further testing. And I'm going to say, in these days when we're busy and trying to get you seen and see a room full of patients, you might get referred to urology with the first abnormal test. Don't be surprised if that happens. When you get to urology, they do a biopsy because you can't diagnose prostate cancer based on the test. That PSA is just saying something not right is going on with the prostate and it could be cancer. The diagnosis is made with a biopsy, a little bit of tissue from the prostate that the urologist goes in under, it's like a local anesthesia. So they get you numb before they do it. But they do go in and do a biopsy where they take a little bit of that, send it off to the lab and look for abnormalities. Should that come back positive, then there's a discussion about treatment. Less aggressive prostate cancer, sometimes they watch and wait because most of the time, it grows so slowly. Prostate cancer grows so slowly that a small, less aggressive cancer, they can do what's called watchful waiting and just, check your PSA on a regular basis. Most folks, though, that in what the guidelines say, if you have greater than a 10-year life expectancy, you should have one of these therapies. And one of the more common ones is surgery to remove the prostate with or without radiation or chemotherapy. Okay. How can you reduce your risk of getting prostate cancer? So living a healthy lifestyle, eating plenty of fruits and vegetables and whole grains, limiting your intake of red meat, beef and pork, especially high fat or processed foods. Try to stay at a healthy weight, be physically active. And this one, most people probably wouldn't think about it, but making sure you have sufficient vitamin D. Yeah. So a lot of us when we grow up, we don't do as many milk products, yogurt, those kinds of things. And so you can have a low vitamin D level. That can be checked by your doctor as well. We don't get the sun exposure unless you work outside. And so that's real important. Avoid smoking. That's a big one. And that has been implicated in being a risk factor for prostate cancer and some other cancers as well. Bladder cancer is one as well for that smoking is a potential cause of. Limit alcohol intake and try to stay current on your exams and talk to your doctor about any of your risk factors. A little bit more about diet, low fat diet, plant-based foods, fruits and vegetables, eat fish, and try to, here it even says reduce the amount of dairy products you eat each day. So I'm saying to, do a supplement on the vitamin D. If your doctor says your vitamin D is low, they'll prescribe you some. So yes, that is all I have by way of an introduction, but very much open for questions, even for things we didn't discuss once we do the panel discussion. Thank you all. That's okay.
Thank you guys. She did great, right? Yeah, that was very informative. Thank you so much for sacrificing. I appreciate you, girl. Thank you. I was reminded that I didn't give housekeeping. So if either of you have to use the restroom or for whatever reason something happens and you need to exit, the exits are back here in the back. The restrooms are out these double doors to your right. We will have light refreshments in a few. And if those light refreshments do not fill you up, we do have a deli in here. So, and it's pretty good food. So you're welcome to that as well. But without further ado, we have, I feel partial because he's my uncle. But I would like for us to give our time and attention to Mr. Michael Shields. He will be coming up to share his story and give his insight on prostate cancer. So I'm honored to introduce not just my uncle, but Mr. Michael Shields. So let's give him a round of applause. And then shortly after um, his his speech, we will do the light refreshments. And as a reminder, if you have any questions or if things pop up in your mind, write them down on your note card, and I'll come around and get them. And this will be for the panel to answer your questions and concerns. Thank you.
Thank you. Thank you. Good afternoon. My name is Michael Shields. I'm a retired veteran. I'm a prostate cancer survivor. Thank you. I'm here to share my experience when I was diagnosed with prostate cancer. Some of the things that you heard the doctor says contained to me. I'm also a graduate of Carolina College of Biblical Studies. I'm a minister for 18 years. Also married going on 43 years. I did write out a few little notes. Usually this, I didn't know we would have all these panelists experts. I'm not an expert. I'm just gonna tell you, my feelings. I thought it was gonna be, I don't know my audience. If I'm talking to military, we have a saying that we're gonna never leave no one behind. We're gonna never leave no one behind. And I use this example. One of the greatest soldiers that I know is Forrest Gump. Have you ever seen that movie? Forrest Gump. Forrest kept running in and out of battle until he recovered his buddies. A bullet jumped up and hit him in his buttocks, but that didn't stop it. I just tell you that because you've been sitting for a while, and I like to know my audience is paying attention to what being said. You know, in the military, you got a command of execution. You got a preparatory command, and you got a command of execution. Your preparatory command is getting you ready for what's coming next. So, that being said, John 8:32 says, "You shall know the truth, and the truth shall set you free." I'm finna tell you a truth. On the other side, on the civilian side, said, I'm gonna tell you the truth, nothing but the truth, how it pertains to me. Knowledge. I looked at the program and I seen prostate awareness. And it says knowledge is that something that exists or understand of a solution or subject to be at the present time, based on information or the experience. So we can't soldiers, civilian counterparts, male. It's very, very important that you go to the doctor. Very important. I have a Prisky. Some of you might know what a Prisky is. A Prisky he mixed with a chow. He mixed with a pit bull and a husky. I'm telling you that. I'm telling you this because I want to get your attention. I want to have your total attention here. We are so not hitting on my brother over here, but he got it. He playing on his phone. And this information that you about to hear, it is life changing. As me as a prostate survivor, I had no symptoms. I had no symptoms. You know, I was just going. I was, you know, going to my physician on every 3 months. You know, just living life. You know, working hard. I'm also a 14-year retirement from the Department of Veteran Affairs. So I just live it. You know, cutting grass on the side. And the only little thing that I would say that I noticed is my drive to continue. I go out on the weekend and do anywhere from 5 to 6 houses by myself. Then I got where I couldn't maintain that quality of standard when I was working. I said, well, you know, I'm from the South. I go sit up under the tree and recover a little bit and go back at it. Something my strength wasn't there. Couldn't do it. When I was, what's going on? I just didn't know. Maybe, doctor, you could address this as panel come up. My strength wasn't there, so I'm glad, and I have outstanding doctoring a doctor's team. They called my doctor, my physician called me one day and said, "Hey, your PSA levels is high." Just in the afternoon. I don't know if that's a regular standard or what, but he called me and he said, "I want to refer you." He referred me to, as the doctor said, and I get this gynecologist. I get it mixed. Urologist. Thank you, urologist. Thank you. You're right. So he referred me. We went, and I was able to sit down and talk to him. You know, I have a niece that is a physician. I was gaining information. The first back when he told me, I said, "Yeah." I went, hit Google up, Google DM, you know, hit Google up, trying to gain all the information that I could about my prostate. What's going on? You know, once I found out what was going on, you can't do anything about your prostate if you don't know about it. You got to know as a leader, you got to identify the problem. You have to identify the problem. When you identify the problem as a soldier, then you can take action. Is that right? So this was in October of 2021. And so once I found out that, you know, what the problem was, my immediate thought was my family, my wife. If you have sons, you got to tell your sons that you have prostate cancer because it's hereditary. You got to go and tell your sons, say, hey, you have to get in the habit of going to the doctor at some point in your life. Is this a subject to happen to you? Mom, you know, I'm not a person that fear. I trust in the Lord. But I thought about my wife, what effect, how I'm going to tell my wife of 40 some odd years that I got cancer. You know, it touched me. No one want to have cancer attached to their being. Whatever you are, if you're a father, you owe it to yourself to know what's going on with inside of your body. You have to go to the doctor. You got to be able to talk to the doctor. I'm telling you the truth here. When I went back, I told my wife, I told my sisters and my family, because we are praying family. I know that they were going to put me on the prayer line, and I thank them for it. So that was my feeling. That was my thought, my mindset. I'm gonna beat this thing. It's not gonna take me down. But if it does, then that's the Lord will. You know, I asked my niece that is it anything that I couldn't say, and I gotta give God all the credit and my physicians. I'm not gonna be up here long because my hand is starting to shake and I'm getting too serious about it. But you have to go to the doctor. You have to know what's going on. You gotta, you know, if you're a leader in the civilian world, you have a family. You owe it to your family to take care of yourself. If you a soldier, you know, if I see a soldier, more my heart goes out to it. If he's holding a sign up somewhere and I know he's a soldier, more likely I'm gonna give him a little piece of money. I'm able to do that because that's a fellow brother. You know, he done went through something hard. Maybe I don't know, but we take care of one another. We take care of one another. That's my reason for coming. That's my reason for coming for as a uh, African American. It is more prominent, as the doctor said, that we're gonna attack us more. So I want to be able to help someone along. Don't be so hard that you don't go to the doctor. You don't come to the doctor. You letting your family down. You letting yourself down. Your significant other you letting down. You have to know what's going on inside of your body. You have to know. Uh, One other thing I was saying, I'm gonna sit down. It says, don't you know that your body is a temple? Your body is a temple, not for you, but for God. So you have to take care of that temple. We are, as men, we fixers. We are fixers. You tell me something wrong, and I know it's wrong, I'm going at it. I'm going at it. Do the same for your body. Do the same for your body. Do the same for your family. Do the same. I'll do the same for my Prisky, what his name is, Bingo, because I know he's gonna be waiting on me when I open the door. I think. Thank you.
Take a deep breath.
Yeah, take a deep breath.
Then he did great. He did great. Thank you. Okay, guys, we're gonna take a brief intermission. If you need to use the restrooms again are out here. And then once you return, we do have some light refreshments in the back that you're welcome to grab. And then we're gonna have our panelists to come up. You know who you are, and we will start our panel discussion. And again, make sure you write on your note card any thoughts, any questions that you may have for our panelists or our speaker, our barbers. So write them down for me. All right, we'll take about a 5-minute intermission. Okay. We'll be back at 12:50. All my panelists would begin to make their way to the panel table. And if you have a card and you've written questions, if not, it's okay. You want to just free it and raise your hand, we can do that too. But if you do have a card, I would like to come and pick them up. So if you have a card and something's written on it, just raise your hand and I can pick it up. Can you guys hear me? Okay. Anything that you're seeing in the community yourself that you just want to have discussion about that you may not have had the opportunity to ask. Especially you too. I'm sure if you have anything, especially not the program as well. You see any differences in the reactions from the clients, what you saw before the program, definitely your experience, feedback from your clients, type thing, whatever's on your heart. Without any all right, guys. Ooh, okay. We will begin. Let me stand right here where I was so I can be out the camera's view. We're gonna go ahead and get started with our panel discussion. I know we have it till 1:30, but I didn't want to hold y'all all afternoon. But I would like for our panelists to just go through and introduce themselves so you can get familiar with them. And of course, I do have the note cards. But if you have any other questions throughout the time, feel free to raise your hand and I'll come around, okay? All right, without further ado, we're going to start on this end and work our way down, maybe. So, Dr. Haigler, you guys know, but anything else? Okay, Dr. Haigler, Lori Haigler, she is our medical director with the Cumberland County Department of Public Health. Okay, so we're going to go to Mr. Victor.
Yes, good afternoon. My name is Victor Taylor. I'm going to tell you a little bit about myself. I was a former city councilman for New Bern, North Carolina, the greatest city in the whole state of North Carolina. This is how I speak all over. I actually speak all over the United States on prostate cancer. I'm a prostate cancer survivor. While I was on the board, thank you. While I was on the board of the councilman, I had to worry about prostate cancer, and I decided I wanted to take some men to get screened. And I took 3 vans, city van, to get tested. And out of the 3 vans, I'm the only one came back positive. All right. So I decided to go ahead and step down off the board and pursue advocating for prostate cancer. I speak on Capitol Hill every year. I speak all over the United States. As you see, I'm a champion for zero because I didn't want any man to go through what I had to go through with no family history of cancer at all. At all. Knew nothing about cancer. So as the barbershop, the idea that was going on now with the barbershops, I actually was at I did a mobile town hall that went all through the barbershops with the mayor, city manager, and fire chief and everything. And that idea resonated the same as the barbershops here. So again, you all have the first hand to a lot of people in the community. So that was a great idea going to the barbershops and a lot of barbers that want to share information. So again, I could talk forever. I'm gonna stop right now. So that's Victor Taylor from the great city of New Bern, North Carolina.
Hi, everyone. I am Sanquis Graham. I'm the local public health administrator here at Cumberland County Department of Public Health. And my division is our substance use division as well as our social determinants of health. In the past, I've worked closely with barbershops as well, working to get information out about tobacco use and nicotine use within our community. We know that a lot of individuals are disproportionately affected by cancer from tobacco use, and we also use at higher rates. So thinking about those menthol products and how we can break those addictions and the cravings for that is really important whenever we're thinking about, number one, our men not going to the doctor, having those really strong addictions to nicotine products, and then not being screened properly. And so that's one of the things that I've worked in and trying to educate, and then also make sure that the professionals that are working in those spaces also have good information to share and spread the messaging about not only, hey, these are the risks, but also these are resources that you can use to seek help. And so on your desk, on your table, I did lay out some Quitline NC information. Quitline NC is a great resource for people who are busy and have busy lives, just making sure that they can reach a certified quit coach and that they're able to connect with someone whenever you call, text, chat via web. You're going to reach a live quit coach, someone who can actually talk to you, talk about your triggers, talk about your cravings, and then help you navigate ways to replace that nicotine use and replace it with better habits and other options. And so that's just one of the things within looking at our community, the factors that we have, and the risk factors of continuing to use that I wanted to share with you all today.
Greetings. My name is Dr. Sundiata Morris. I'm co-owner of Barber Kings as well as Morrison Quail Hair Restoration Center. Also the vice president of Cut My City, where we serve underprivileged families, so we're free haircuts in the community. And first, I want to thank Commissioner Adams as well as Department of Health for the great partnership that we have had thus far. And I appreciate y'all. Thank you.
Good afternoon. My name is Victor Crumpler. I'm an owner of True Blendz Barbershops here in Fayetteville, North Carolina. And also, I would like to thank Glenn Adams as well, Commissioner Adams. He saw me and came up to me and told me about the program. And when he told me about it, I thought it would be a great partnership with barbershops and what they were going to be doing with the Healthy Conversations. I thought it was a good marriage and good partnership. And I could see where we were already talking to people. So it wasn't where we would have to go out looking for anybody. People was already coming to us. We were already engaging, our clients and talking to them anyway. So I just thought it was a perfect fit for us to come together and just continue to educate and, talk about these healthy conversations.
Good afternoon, all. My name is Dr. Airana Griffith-Knight. I am a professional cosmetologist, so not a barber. And where I fit into the equation is I am a practicing trichologist. I've spent about a quarter of a century, the last quarter of a century, talking to both women and men about issues that cause hair disparity. So why are we losing our hair? And I want to thank Carlotta for reaching out about this healthy conversations, because as a practicing trichologist, I always look for opportunities to let people understand what hair really is and how hair is an indicator of things that are going on within the body. So if you begin to lose hair, or if you have any type of hair disparities, the first place you want to stop is to see a medical doctor. And so having the healthy conversations actually just open up a place for us to just kind of speak, especially as I'm looking, if I see anything going on that may be a little bit aberrant from what they expect to go on. So I'm excited about the conversations. I'm excited about meeting new people and also discussing hair loss and ways in which people can look at hair differently. Thank you.
So we're going to go ahead and jump into some questions. I have a few in my hand. And again, if you have any that just pop up in your mind, just raise your hand, okay? So the first one it says, does the health department offer free PSA exams? I'm going to let somebody else answer that question. We have.
Oh, okay. So the health department has two primary care offering agencies under our roof. It's Stedman Wade Medical, and they have a couple of other branches in the community as well. And then there's Cumberland Health Net. Stedman Wade is an FQHC, meaning they're federally qualified, meaning that you can pay on a sliding scale, but they also accept all insurances. Cumberland Health Net is for the uninsured, and they have to meet some income requirements, but most uninsured will be able to get into those programs. And PSAs can be done by the providers in both of those agencies. And it's really important that the PSA is connected to a provider. So if you ever go out and get a free PSA, make sure you have a primary care or somebody you can go to when that result comes back, I would say.
Thank you. Okay, so the next one, are there prostate support groups in the area? We have one vendor back here. I think that Mike could speak to it. And there are some on our panel who I'm sure would love to share it. So, Mr.
Okay,
Victor.
is there any support group leaders or members in the room before I go to mine?
Go ahead.
I actually was the chairman of my prostate cancer group in New Bern. We have the largest, the greatest, and I'm saying this because it's been proven by the state of North Carolina that we are the greatest support group in the whole state of North Carolina, to the point that they mentor and they Zoom in my meetings. We have 115 members on the roster, about 35 shows up every meeting. I call a support group a survivor, because it wasn't for the support group, I don't think I will be here. So when I say that, I task myself to put 80 support groups in the whole state of North Carolina. I've already got 12 up and running, and I'll be coming in Cumberland County if they don't have one, but I will be putting support groups in 80 counties. There's 100 counties in the state of North Carolina. However, there's rural areas that broadband is going to be an issue. So again, if you do not have a support group in this area, want to get one started, if you do, connect yourself with it. They spoke about earlier about the ladies in the room. I speak to over 100 churches a year, and as we know, there's mostly women in the churches, and sometimes I go to church and nothing but women in the congregation. Whatever directly affects us, indirectly affects you all. You all retain more, you all write stuff down, you all ask the questions. When we get the word C, we get quiet. Our brain shuts down. So again, support groups are survivorships. So if it's not one here, I will be contacting both of these ladies here to make sure we get one here, and Commissioner and the doctor right here beside him to make sure it is. I'll share you my card, but I will come here on my dollar to make sure a support group is here and all over. Yes, ma'am. Prostate Cancer Support Group of Craven County. We have a website, we have a Facebook page. Okay, and as you look on my page, it's Vision Forward. You can find everything that I do. You'll see this up there as well. So I get questions all over the United States, all over the world, asking me questions. I'm not a doctor, but I go to all kinds of conferences, sessions, and get information and share it, because there's no need to get something and not share it. So like I said, I could talk forever, but there's another panel here. So again, thank you.
Thank you. Okay, the next one says or asks, can PSA exams screen for colon cancer? Can PSA exams potentially screen for colon cancers also?
Oh, so the question was, can PSAs potentially screen for colon cancer? So every, I would say, organ system in the body has its own sort of milieu or all own sort of characteristics. So the test checks specifically for something to do with that system. So for colon cancer will usually result in some blood being seen in the stool. That's like the first sign. There are other, and that's the one that's available to consumers through your doctors, is those kinds of tests, and of course, colonoscopy. There's antigens, just like that PSA that colon cancer makes, but they're just not something that's been used widely. They're more sort of research purposes. So that's no for the PSA for colon cancer. It has its own test.
Follow up to that, is prostate cancer the same as having a colonoscopy?
So,
and how can these be tested for free?
Okay, good question.
Maybe we need to understand the correlation between prostate and then colon. I guess maybe because I'm trying to think if the person in the room wants to clarify, but the organs are completely different.
It's totally different. Believe me, that's not a dumb question, because I get these questions all the time. People ask me, I tell them about, the first thing is you have to have an elevator speech, and I walk up to the doctor and say, have you had your prostate checked? And she's gonna instantly, knowing that she knows, she's gonna say no. Some ladies say yes. Some men say they don't know. So it's not a dumb question. Some of them say I got it checked. I got my PSA, got my prostate checked when I was doing a colonoscopy. You can't do both of them at the same time. Colonoscopy is different from a prostate exam. It's totally different. Prostate cancer, and Doc, I heard you say it earlier, the PSA is the blood, 69%. The DRE is the blue glove. A lot of guys, when you say blue glove, you know exactly what we're going to happen. Okay, that's 31% of it. And I say this, Doc, and I think the gentleman here said it, I had no symptoms at all when I came back positive. It's called suspect now. I had no symptoms. And I don't sugarcoat my conversations. I apologize if some of you all get offended. I had no incontinence. I had no ED at all. My sex life was great, but I had 85% of my prostate was cancerous. Okay? And the only way they found it was through the DRE. Uncomfortable for a moment, but worth for a lifetime. Men, they only up there for about 1-2 seconds. They're not up there to play, they're up there to feel. If something feels abnormal, then they're gonna come back and do the biopsy, the PSA, PET scan now. But it's uncomfortable for that one moment, okay? Also, I get guys that say, I'm gonna be gay after I finish. I'm telling you, I don't sugarcoat my conversations. It's not gonna happen. It's not gonna turn you to gay, okay? So don't worry about that. Don't worry about the side effects. I didn't worry about it. I was 42 when I was diagnosed. I'm 61 now, okay? And I'm put on the spot. My sex life is still the same. I don't sugarcoat. Okay, some people need to hear this. If you sugarcoat, somebody gonna miss it. All right? That's how I talk everywhere I talk. All right? Thank you.
That's so funny. Thank you. Thank you so much. No, that needed to be said. Someone needed that word. The next question is for our barbers, stylists, salons. How receptive are the men to these conversations? So you're in the shop, not even just like I said before the program, but how are men receiving these conversations about prostate cancer, screening, all the above?
My experiences, I've been pretty big on visual aid. So a lot of times when I have a client that comes in, they see the actual setup from the health department that we have. And I always show a video, and they've been very receptive to the fact that they actually see it. It makes them want to ask questions. And I think some of the videos that I've given and shown has been a great big deal to them being able to be vulnerable and talk about, certain things when it comes to the prostate.
I'll share one quick experience. Back in, I think it was March, I had a gentleman that came into the barbershop, and we started to have a conversation. And into the conversation, I ended up finding out that his father was diagnosed with prostate cancer early on when he was younger. And he had went years and years and years, and he was he's in his 40s now, and he hadn't thought anything about it. But because of us having a conversation, it sparked something back in his mind of what happened to his father. And so he decided that he wanted to go and, take his health more serious at this stage in his life and go get tested. So first thing I did is I reached out to Carlotta because, again, he was asking, where can I go? I don't have health insurance. I don't have this. I don't have that. So I reached out to Carlotta, and they were able to put me in contact with people to put him in contact with to help him, reach out to those resources and those aids to try to help get him, on track so that he wouldn't face what his father ended up facing, years earlier. So the program has been vitally important and has been successful in helping men.
Education is important, right? And like education, you learn from the last place in which you last knew something. A lot of times we don't know that we don't know something until we get into a casual conversation. And so some of our trainings that we had to go through the health department, they taught us how to have casual conversations. And so through casual conversations and consultations, we're able to bring things up and have discussions that people normally would not have.
Thank you guys for sharing that input. That's very important. We have another question, and I think it might be for you, Mr. Victor, but either of you feel free to answer. How did you get to have the DRE more so before you had the PSA? And what was the signs that led to the doctor saying, hey, you need to have this test?
Well, as the doctor said here, it's always best to have the PSA prior to the DRE. Because as you see, some things that can cause that PSA to rise, that's one of them as well. As if you do the fist like this, your prostate is similar like that. If it feels right here, this is how it's supposed to feel. Okay? If it feels like the knuckle, that means there's some abnormality on your prostate. That's when they're gonna start being concerned. All right. That is what they feeling for. See if they feel just like this. Like I said, they only do that 2 seconds. They just doing this right here. If they feel something like this, that's when they got a suspicion to start doing a biopsy or a what is called PSMA, PET scan now. But the biopsy is 11 cultures. They put them on the microscope. They look at them. Out of the 11, I had 7 that was cancerous on mine. I had cancer on the inside as well as cancer on the outside of mine, with no symptoms at all. All right, so no symptoms at all. So, I did answer the question.
Answer the question. If the person in the room doesn't, you feel like that was answered.
Done versus getting the results in the PSA that shows that you didn't have any trace of a higher level.
Okay.
That's that signal. What is that signal? Because that's something that possibly, as we have healthy conversations in the barbershops, we could also kind of administer that for them to be aware of that too as well.
The symptoms to identify that you should go get checked, Doc talked about it earlier, i.e. the ED, i.e. frequent use of the restroom throughout the day, throughout the night, different types of things, like anything that's going on in your growing area, you definitely need to get checked out, okay? Also, there's 3 risk factors Doc talked about it earlier. Age 40, and I heard this all over the United States, age 40, African American, and family history. Okay, as I look around the room, all the men here has 2 of those risk factors already. So therefore, you should need to get started testing at age of 40 every year. Okay, because I had a guy in a and also, as you said, second opinion is important because it could be false positive, or the machine could have a problem, the nurse could have a problem, the doctor could even have a problem that day. So you don't want to take that first finding, get a second opinion. If the doc doesn't like your second opinion, you need to find another doctor anyway. I tell you, I don't sugarcoat anything. And back to the other question, in the greatest city of New Bern, y'all gonna remember me, the greatest city of the state of North Carolina, I did a screening about a month ago. UNC Duke came down and did it. 225 men in three hours. The largest screening they ever seen. Because I got to the barbershops and let them know that we're doing this screening totally free. So to get one free, you had to get with the health department. They had to get the urologist, oncologist, radiologist, get them together and put it together. They can do just the PSA, it's cheaper, and you can get 69%. But you can do it free, but you just got to know what avenues to go. So yes, certain symptoms, if you're riding a bike, you're driving a truck bounce up and down. As I was saying, I'm proud military. I went to Duke because Durham deals with Duke and UNC. Great doctors, great specialists. They said the same thing. All my surgery got done up there. Even though City of New Bern is great, but I went to Duke, where Chapel Hill and Duke doctors were doing this surgery and did a great job. Okay, so that's good.
Was a great response. We do have another question, but I'm gonna chime in and put a little bit as an educator too. So signs and symptoms are two separate things. So when you and y'all, I don't want to do. I'm not Dr. Haigler, okay, but I'm gonna just or this other young man, Mr. Victor, anybody up there. But when you look at signs, those are like the physical things that you can see. Symptoms are what you as the person are experiencing. So one of the questions is, being that they had no symptoms, do you think having low testosterone could cause like weakness, which was one of his Mr. Shields experiences with a symptom? So when you look at the differences, a sign may be like the prostate, like he shared, had some things going on the outside. You can see that with your eye. Um, a symptom, like if I have a cold, my chest may be hurting. You can't feel that my chest is hurting, but that's my symptom. So everyone may not be aware of their symptom. You know, not everyone feels pain like we feel pain. So this is what people are sharing when they are diagnosed with cancer. Hey, this is what I experienced. This is what I had dealt with. This is what I felt, versus the screening and the exams. And these are the signs that they visibly could see. And I'm going to hush and see if Dr. Haigler wants to answer, or Mr. Victor, about that question. Being that they had no symptoms, do you think having low testosterone caused the weakness?
Weakness. So whenever you have an infection, sort of, your body sort of responds to that. Your immune system sends out all kinds of cells and mediators to take care of that. And when that happens, it takes a lot out of the body. And so you're going to start have that fatigue and weakness and some malaise and just not feel like yourself. Don't ignore it. I mean, if you've rested and you are still feeling this way, then you definitely should get to your doctor to get checked out, get some labs at least to find out and make sure that everything's okay. And if not, you go back and follow up, and I'm still tired, or I still can't do, my normal activities. Because yes, that is a sign that, your body's fighting something.
Yeah, thank you, Dr. Haigler. We have two more questions because we're at our 1:30 hour. By all means, I don't have to cut it off at all if y'all have more questions, but I do want to make sure that we get these two questions. One is a very important question because you will hear some people advocate and say race should not be a factor. I've heard that recently. That's unfair to say, oh, just because I'm Black, I'm going to have cancer, or I'm going to be prone to having high blood pressure, So that was a question. What is it about being a Black man that puts you at a higher risk for prostate cancer specifically? Is it because I'm just Black, or is there some data behind it saying, hey, because you are African American or Black, this is why?
I'll try to answer that one. So prostate cancer, specifically, there's studies, and these studies have, when a man has prostate cancer, they, depending, you could be involved in a study, or people can use what they call secondary data. They can go look at hospital records and see your race and what you were diagnosed with, and that's how they come up with these numbers. And that was part of it, I would say. But then there are these correlations with risk factors to do with race. Take, for instance, we used to have this formula for we have this formula that we use for kidney function. And it would be like, you look at the labs, and it was the EGFR. This is really how well your kidneys work. And they would have a different number for Black people and a different number for white people. So I always wondered why that was. And this is one of those situations where now scientists are looking at that and they really can't find a good reason why those numbers were there. So it's a great question to ask, like, where did that come from? Ask your doctor, why is it? Because, the same question you're asking now, is it because I'm Black or is there something else?
That's a great question. I think we have a follow-up to
Yeah, I'm Dr. Lumumba Kwao, and one of the things that I saw that we talked about is the prostate, but we never really thought about some of the healing properties, and actually some of the things that possibly, if before the prostate could get to that point, what you can do as a person to really understand your digestive system. Um, our system is set up in such a way that we never were really documenting what our engine parts were, how we were able to understand the anatomy of our body and how it works. Like the gentleman that was speaking from the military said that to know your system and know your parts that's injured, then you'll be able to go to the doctor and really talk about that part to really see what's the best solution for the problem. Now, some of the biggest thing that I have worked on over me and Dr. Sundiata was we had got into the CMOS business and we got into holistic medicine based on true trichology and the hair loss and how that corresponds with the body, and it is a telltale sign for so much things that's happening in the body. The CMOS is also it has antioxidants, and it removes inflammation from the body too as well. And it also it will help you if you in a prostate diagnosed person too as well. Um, the lime and lemon juice is another thing too that actually goes in as an antioxidant, but it also cuts down weight loss too over a period of time. So that weight loss too helps the person to keep their weight in balance, to not put a lot of pressure on the prostate. Then you have the fruits and the fruits and vegetables like you talk about, which I actually introduce in my drink that I make. But the fruits and vegetables is the vitamin C, and it also is good with a healthy bacteria for the gut. It works with the good bacteria. So if we know what we're putting into our bodies and we start being controlled and understand what it is, I think that you might get a better results in your doctor's results when you go to a doctor, giving that an opportunity to work and coincide with the medicine too as well. I don't say go all the way holistic, but it still takes a part that will be able to help you with your gut, that really will be able to make the body function well. I've been doing some research on it, and I have people that have used it and they have seen couple results that actually turned over that helped them just to bring the levels down, the blood pressure down, and bring everything in regulation.
Thank you. We could be here all day talking about holistic wellness and the medical world and the variations and thoughts between the FDA and what's approved and what's not approved and what's okay to do holistically versus medically. We'll have to do a side conversation with that one day. But thank you for that input. And a risk factor or prevention is making sure you're being mindful of your diet and what you are putting into your body. So that's a very accurate statement. One more thing. And if you guys have any questions, now would be your time to bring them up. If not, then I'll be closing.
I wanted to add something.
Yes, ma'am.
Yes.
Go ahead.
So I did want to just place emphasis on the piece about education. I think whenever we do talk about our community and individuals being diagnosed and then having those more lethal diagnoses, we want to make sure that we're identifying the fact that they're not being screened. And so whenever they do ignore all of those signs and symptoms and they wait to the very end, we're seeing higher risk of, adverse outcomes. And so that's why it's so important for us to educate and to get in front of those signs and symptoms. So when we're first seeing them, we're going to the doctor, we're having those regular appointments, and we're being more conscious of our health, and we are implementing those healthier practices. And so I just wanted to make sure that I highlighted that part. That's why we really wanted to work with our barbers to make sure that those conversations are happening so that people are not waiting until they have really bad outcomes and then they're in the emergency room versus going to their primary care physicians and being early in that process. Yeah.
Ms. Sanquis, thank you. You just brought something to my thought. So prevention is definitely important. And then just understanding, I got you. And so when we look at the ways that people choose to cope with just life, as they say, life's sometimes, and tobacco use is one way that people cope through life, very harmful to our bodies. We love to eat. We're in the South, so we will cook and char our food and grill. I like grill food too, but it's not the best for us all the time. We are a meat heavy society, so we are not eating as we should, but prevention is very important. So thank you for highlighting that, and you too, Dr. Sundiata, Lamomba, I'm sorry. So we had a question for our survivor. Are you okay to answer it? Okay, so his question was, what treatment did you receive, and are you in remission at this time? You don't have to say.
No, thank you. I received the not the radiation, and I am in remission.
Yay.
Amen.
Thank you. Treatment options are, like they said earlier, they vary. So it's important to talk to your doctor about those options. Okay, one more, and then I'm gonna do my little spiel and thank you.
I have a question because I am a barber as well, but I do have homosexuals in my that comes in to get service or whatever, and I talk to them about this. But does that, yeah, excuse me, does anal sex men, does it make it higher risk? I think that's what I'm trying. You know what I'm saying? So I can let them know, that they really have to get checked. You know what I mean?
That's a great question, a really important question.
That's a good question.
There are, behaviors that can make you at more risk for certain conditions. I have not seen that a behavior or men who have sex with men would increase their risk for prostate cancer, but colorectal cancer, anal cancer, there is a correlation with that. And there are many efforts now to teach doctors to do anal paps, like, a female goes in and gets the cervical, a pap for that. And so the same thing with men who have sex with men. It is important for them, not necessarily prostate cancer, but that colorectal cancer, the risk is increased there.
Good question. Go ahead, you got the mic.
I'm gonna get 30 seconds because I always open up my meetings and close my meetings with this here. And I'm gonna show it to you. I'll show it to the doctor first. All right, early detection saves lives. And I got one more. If you all went to the grocery store the last couple of nights, you might have seen this here. Everyone knows what this is, correct? Not a trick question. I start off just saying that's how I start my meetings. All right. However, being that I'm an advocate for prostate cancer all over the United States, I want you all to start talking about prostate cancer and make it this big. I want you to make prostate cancer a household word. Talk about prostate cancer in the barbershop, salons, Walmart, at work, at church, at funerals, because I'm a prostate. They call me the prostate cancer man. They ask me questions at the stoplight. So I want you all to talk about prostate cancer because 286,000 will be diagnosed this year. 35,000 will die from prostate cancer alone this year. And every year it keeps moving up or down, but we need to make sure we move it down. All right. So again, thank you all for inviting me. Again, the greatest city in the whole state of North Carolina is New Bern, North Carolina.
I'm gonna say. That was a good response. Good job. Good comeback. If there is one question that was online, and then I'm gonna end it with one more. So the question online, what I took from it was similar to breast cancer. There are certain genetic predispositions that we have. The question was, are there any registries? Are there any type of models or inclinations, I don't, but the word was registry for genes, genetics towards prostate cancer?
Yeah, that's a very good question. And the same genes that are found in breast cancer, the BRCA or the BRCA1 and 2, have been found and associated with prostate cancer. Yeah, exactly. So,
Your sister
so
has it.
yeah,
Your sister has it. All men should get tested
Mhm.
for prostate. So they're brothers and sisters.
they are.
That's such a good question. Then I personally didn't know that. So if a woman genetically has the BRCA and is diagnosed, and say she's a mom, and she found out she had the gene, now she needs to let her son know, hey, I need you to go
Yes.
get tested for prostate cancer, because that was such a good one. I gained a new wrinkle in my brain today. That was so good. Thank you, online person, for questioning that. You have one? Okay, and then oh, Cancer Man. Okay, well, I just want to thank everyone for coming. My panelists, can we give them a hand? Y'all did great. And our barbers, if you have any questions for our barbers and cosmetologists, and if you would like to meet and greet them, they will be all aligned over here. They may have some handouts, some goodies, some business cards for you. But we did, and I want to end with this saying, as a barber, this is for my barbers. As a barber, would you encourage other barbers to join the program, and why? And then, of course, do you think the program should continue? So the first one, would you encourage other barbers to join the program? Why? Why? Hmm.
I would encourage every barber, every stylist to get what do I want to say? The pamphlets, the we have cholesterol tubes, we have models of prostates, we have models of hearts, we have the walnut of about the size of a prostate. The conversations that it has opened with children to adults, especially children, because I learned something about testicular cancer in our young boys from 18 to like 25. They're at high risk, and I didn't know that. And I have a 19-year-old. So to now be able to tell other young men, like, hey, if you feel a certain way, tell your mom or tell your dad. Don't feel embarrassed if your balls hurt. Say something. So this program has opened up a lot of doors. So I'm very appreciative, for joining, for showing up, and like Miss Knight said earlier, like when we went through our what we used to do, our role playing, that was fun, and it helped us become more open to talk to our customers, even though we already had these conversations. But it's really fun.
So glad y'all think it's. I'm so glad our time wasn't okay. Well, there's a microphone up there. Yeah.
Yeah.
Just say ditto.
I would definitely encourage more people to join, because like I was saying earlier, hair loss doesn't come just from the top of the hair, because hair is coming. If you are losing hair, if you have like disparities within the hair shaft, you can't keep moisture, those types of things, that is because there's something going on internally. Hair is made of, we have it, we call cons: carbon, oxygen, hydrogen, nitrogen, and sulfur. If your body is off balance, that means that one of your 10 systems are pulling more carbon, oxygen, hydrogen, nitrogen, or sulfur. And this is why you're experiencing any type of hair disparity. So I believe that we need to spread that. It's not about looking good, having this hair, because, we have to have it look good, and we have to have it fried, dyed, and laid to the side. But it is a key indicator that something is going on within the body, within the bloodstream. There have been studies to show links between baldness, like vortex balding, male pattern balding, those types of things with various cancers. So Hair is like the lowest man on the totem pole. If there's something going on with your heart, it's going to pull those vitamins and minerals. If something is going on with your digestive glands, because you are what you eat, but also what your body is able to absorb. So if you're having absorption issues, digestive issues, you are going to see those resulting on a negative impact within the hair. So yeah, more stylists and more barbers need to be included in these conversations. Thank you so much, Commissioner Adams, for being vigilant and seeing what's out in other counties and bringing it back to Cumberland County. Thank you.
Just to add, yes, 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 and yes. I can only have a certain reach or the sphere of influence that I have, as well as Dr. Sean, as well as Dr. Griffin, as well as all the other barbers and beauticians that are in the program. But the more that are involved, the more greater our reach can be to help save someone's life, and that's what it's about at the end of the day. So yes.
I'd like to congratulate each of the barbers that's a part of the program for being the leaders of this partnership and pilot program. Thank you, Commissioner Adams, for having us all. And yes, I think we need to bring more barbers on, so we can spread the word and be prostate cancer speakers, advocates as well. So yeah, thank you.
Thank you guys so much. Thank you. So without further ado, thank you guys for attending. Yes, ma'am. I think so too. This was good. Give yourselves a hand for coming, because I was a little nervous. Okay, more conversations.
Oh. Those are things that also help stimulate conversations too. Just knowing like, oh, we're gonna have this panel discussion next month on breast cancer, and having any type of conversation starters, again, because it's about casual conversations. People will share and exchange on casual conversation. So just telling people like, oh yeah, we have the prostate. Well, what's that? And another one of my stylists, she wanted to be here, and I'm just like, hey, you just show up. So yeah. Let's have more.
I agree. More. So we do have more events in the future, and I encourage you to follow our social media if you are on our social media.
One last thing. If the health department can find some kind of way to duplicate Carlotta, that would be great. She's been a great director, and she stays calling and texting and reaching out to us to see if there's anything that we need to help the program be successful. So, hey, thank you, Carlotta, for all that you do. Thank you.
You're going to make me cry.
My constituents have some nourishment for your prostate over there, as well as some hair products for your scalp. Please stop by that table over there and check them out.
They are really good, guys. They are. They do. They're really good. But
Carlotta, I had one more thing.
Okay, go ahead. Hey, we all on the clock. I'm okay.
I'm gonna let you all go, but there was one thing mentioned earlier, and it was about people using nicotine to relieve stress. I just wanted to let everyone in the room know that that is actually something that increases your stress levels. And so, whenever people are telling you that they smoke because they're stressed or they vape because they're stressed, please let them know that they are actually increasing their own stress levels when they do that. So that was the only thing I wanted to add.
I got one more thing. As you see my shirt, I wear this shirt quite a bit because, as I said, I went in the grocery store last night. It was pink on my bananas. It's not till October, and they already advertised it. Okay, so this is September. Not all cancer is pink, because there's other cancers out here that need to be have attention as well. Breast cancer is important. Some men, percentage, can get breast cancer, but every man in this room could get prostate cancer. We get $120 million last year from the congressman for advocating for prostate cancer. Breast cancer, we had 109 advocates there. had no breast cancer. They got $150 million, and we had 120 million with 109 people.
Yeah, drops the mic on that one. Yeah. Yeah, no, I understand what you're saying. Be aware of all of them, promote all of them because they're all important. Thank you guys again for coming. Please, I'm gonna just put this little blurb out there. Please follow us on social media. If you have social media, we do post a lot of our events and we have some really great community outreach programs. So we also have an app. I know y'all are tired of downloading apps, but we do have an app the county does. So download that. And again, thank you. There are still some refreshments back there. If you're still a little hungry, please do go by and say hi to our barbers. And we also have some vendors over here. Information so the ED, erectile dysfunction, can mimic other things. So we have our communicable diseases and other things. And the care clinic is back there. They are a free service in the community. If you know someone who says, "Hey, I just don't have any insurance," and they need some general practitioner type things, they're back there. So thank you guys and have a good afternoon.